Good morning, everyone. Can you all hear me okay? Yes. Okay. Lovely to see you all's faces this morning. It's 10 o'clock, so we'll go ahead and get started. Welcome to our first communication committee meeting here with the Tarrant County Unity Council. Glad everyone's here, so we'll go ahead and jump in. I'm sure people will continue to kind of trickle in a little bit, but we'll go ahead and get started now. So first things first, just a brief introduction. My name is Tanisha Stanford. I'm a health equity specialist here with Tarrant County Public Health, and I'll be leading the communication committee here as well as the education committee as we seek and you know seek to make equitable changes here in Tarrant County. And I know things are still a little weird here with us as we continue to meet virtually. But if you're able to, please turn on your cameras so we can see everyone's faces and, interact with each other as best we can. Um, and at this time, I'd like for everyone to provide a brief introduction, just your name, your title, the organization you're here representing, and, maybe why you're interested in this communication committee or, what you're hoping to get out of it. Somebody take it away.
I'll jump out and start. I'm Lauren Donnell. I'm the Health Equity Supervisor, so I'm over here on the public health equity team side of things, and I'm excited to be here with you guys this morning. There's a lot of things that can be covered under the communications umbrella. I think that Tanisha is probably going to walk us through that this morning, but um, coming on the heels of this pandemic, I am particularly interested in how we can address the the spread of mis or disinformation that we've seen throughout the COVID-19 pandemic, um, as well as how we get that correct information out to the communities that are traditionally not hearing that information so that we can better serve folks in the next public health emergency.
Absolutely, absolutely. Thank you, Lauren.
I'll go next. My name is Matt Zavatsky. I am the Chief Transformation Officer for MedStar, the ambulance and EMS provider here in Fort Worth. I'm not trying to hide my identity. It's just when we all set up offices many years ago, we didn't realize how difficult it would be to have light behind you. And it's too much trouble to move all the desks around so you have the light in front of you. So I apologize for that. Wonderful invitation, honored to be part of this group. We have great relationships with our community and media partners and others, and really look forward to partnering with Tarrant County Public Health on helping spread factual, pertinent, and relevant information in the future, which is something that really didn't happen as well as many of us may have liked over the last 2 years. So happy to be part of the group. Thank you for the chance.
Absolutely. Thank you, Matt, for sharing.
I'll go next. Good morning. I'm Nikita Russell. I'm the Executive Director of Public Relations Communications for Everman ISD. And like Matt said, it was great working with you all to make sure that we're giving our parents and community correct information in a timely manner and everything. So we appreciate this opportunity for Everman ISD.
Absolutely. Thank you, Miss Nikita. Excuse me, Dr. Nikita.
Hi, I'm Tanya, Tanya Till, and I'm here with the rest of the health equity specialists. My area of focus is health, and I assist with housing. And I would like to see, in regards to communication, a lot of the barriers in the healthcare be addressed. A lot of people are not receiving the proper health care because there is a language barrier. People feel like they're not being heard and things of such. And also, just like, everybody has pretty much said, um, information. making sure that people are getting the right information. Usually when something goes out, we see it in English and Spanish, and it kind of stops there. Well, what about the other populations of people who speak other than those two languages? So it's kind of like they have to go into somewhere, get an interpreter, and they have to feel comfortable and safe to even get the health services that they need. So I'm just curious and ready to just learn how we can move forward for our community as communication is concerned. Thank you.
I'll
My
go
name is
next.
Barbara
I
Young. Oops, go ahead.
Go ahead, Barbara.
My name is Barbara Young. I'm a health equity specialist here at Tarrant County Public Health. My specialty will be transportation and internal policies here with Tarrant County Public Health Department. And I am interested in hoping that the whole community can get information that's needed to be gotten in regards to equity issues. Thank you.
I am Roy Van. I'm here with iHeartMedia, as well as Veronica uh, and David, who you see on the call. We are all with iHeartMedia. I'm Director of Brand Partnerships. Our job is really just to look at ways that we can help you guys get the accurate information to the different communities who need it in several different ways, from broadcast radio to the Black Information Network, which is a radio network that we launched 2 years ago, to podcasts and all different advertising channels that we can use to reach the public in Tarrant County. So we're excited and thankful to be here today.
Thank you, Roy, for sharing. Would anyone else like to jump in?
Hi, I'm Barbara Griffith. I'm sorry I'm late. We were working on a deadline here. I'm with the Student Communications Department, and we're just here to build relationships and get share information more effectively.
Absolutely, absolutely. Thank you, Miss Barbara. Okay. Anyone else like to jump in?
Good morning. I'm Deanna Madrid. I'm with the Potter's House of Fort Worth, and I'm just here to gather information and see how we can communicate to our community in a better way. So I'm just looking forward to working with you all. Thank you.
Absolutely. Thank you, Deanna. Thank you for coming and being a part of this here. Any stragglers? All right. Well, then we'll just go ahead and move on then. So, just to give a quick, brief overview of the meeting, these meetings will definitely be more discussion based because, we definitely want to hear what you all are looking for and, see how we can help you all make changes within your organizations. But I do want to go over a little bit of data just so we can kind of get our brains turning of what we're up against, and just seeing some of the disparities that exist here in Tarrant County and, how we communicate and receive information. Okay. Okay. So we'll jump into, I would say, one of the most obvious communication barriers here within Tarrant County, which is spoken languages. Um, According to the 2019 U.S. Census, nearly 30% of Tarrant County speaks a language other than English, compared to the state of Texas, which has a population of 35% that speak a language other than English. And further, we have foreign-born citizens that make up 16.3% of Tarrant County populations in comparison to the state at 17.1%. So here we can already see, just looking at the data shown, like just the significant population that just may not speak English or may not even have the cultural background to kind of navigate those resources that are around them. The 2020 JPS Needs Assessment found some similar data, but also included a national average. And just to dig a little bit deeper into that 30% of Tarrant County that doesn't speak English, the needs assessment suggests that there are 125 different languages spoken in Tarrant County. Outside of the top two, which are, of course, English and Spanish, some other languages that we are seeing spoken throughout Tarrant County include Vietnamese, Arabic, Congolese, and Burmese, just to name a few. Okay. And while some people may be bilingual or even trilingual, and are able to understand English enough, the U.S. Census still states that Tarrant County has 220,000 residents, basically 12% of their residents with limited English proficiency, which of course impacts their understanding of health information, as well as just information about the communities around them. Okay. And then, kind of just to go into it a little bit by zip code, we see in the 76164 and 76106 zip codes that the most prominent language spoken in home is Spanish. Now, as Tanya mentioned earlier, of course, we do have resources that we present in English and Spanish equally. However, still, we don't take into consideration when these people walk into buildings and facilities and they might not have anyone that represents them or speaks their language. And then when we move into when we move into the 76164 and 76106, the 76119 and 76112 zip code, we can see that these are mostly or historically have been black populations. However, we can still see where they break it down to other communities or other languages that are spoken in these communities. And still, we still have to accommodate for these people as they look for resources and navigate their communities around them. And even though, majority of these populations do speak English, there are other disparities that exist in helping them to kind of navigate everything for them. And I feel like something that we don't always take into consideration when we think about communication barriers might be ages and abilities, especially in this era of technology and the COVID-19 era, where a lot of our information is presented to us through digital platforms. And so I feel like we have to take into consideration the elders in our population who may not be as technology savvy. So, of course, with that being said, they might miss important public information or even just in public health information for them. For example, just to give a personal example, earlier this year, my own dad missed some very important information that was presented to him through an app. He didn't know what the app was. He didn't know how to work the app once he downloaded it. Luckily, he has me to help him navigate and make sense of things, but not everyone has that kind of support system around them. So, how do we ensure equitable communication for the 11% of elders or older population within Tarrant County? And further, according to the 2020 U.S. Census report, more than 10% of Tarrant County possesses some form of disability that could affect their ability to communicate their needs, receive important information, and thus, simply navigate the environment and resources around them. So again, how can we ensure equitable communication and access to communication for these groups? Now, language disparities, age disabilities, accessibility, education, and other barriers of communication are all basically major contributors to literacy and health literacy of a community. So before we get into the literacy statistics within Tarrant County, I do think it's important for us to kind of break down the difference between literacy and health literacy. So, literacy is simply the ability to read, write, and listen in a way that allows us to communicate effectively and navigate the environment around us. And then the CDC breaks health literacy down into two separate definitions. The first is personal health literacy, which is the degree to which individuals have the ability to find, understand, and use information and services to inform health related decisions and actions for themselves and others. And the second definition is organizational health literacy, which is defined as the degree to which organizations equitably enable individuals to find, understand, and use information and services to inform health related decisions and actions for themselves and others. Okay. And so, according to the Health Resources and Services Administration, we know that low health literacy is more prevalent among older adults, minority populations, communities with low socioeconomic status, and medically underserved people. The Pro Literacy Initiative, excuse me, the Tarrant Literacy Coalition states that within Tarrant County, approximately 1 in 5 adults in Tarrant County cannot read well enough to succeed at a fourth grade level. And then less than 10,000 adults in Tarrant County are enrolled in any kind of adult literacy program at that time. And then here in the slide, we can see uh, our star data here for the reading level for third through eighth grade. And if you look over to your right hand side, we can see that we're not reading. At any level, is anyone reading at above a 50% level? Or, the percentage of students that are meeting the state requirements are at a 50% level. So, um, we definitely have to look into these. And then this STAR data can actually be used on excuse me, this star data can be found on this star data access tool, and we'll go ahead and drop that link for you in the chat. And it's a really cool tool. You can definitely go through all of the Texas school districts. You can break it down by campus, demographic, grade level, subject, and more. So that's definitely something you all might want to play around with if you're interested in looking at, star information. Okay. And further, the Central Connecticut State University completed a 10-year study ending in 2014 of literacy indicators in 77 metro areas within populations over 250,000, and Fort Worth ranked 53.5. They tied with Las Vegas out of 77. So literacy rates at 53.5 out of 77. And the state of Texas ranks 47 out of 50 states. So we definitely are seeing some literacy issues here on the state level and a county level. And then just nationally, just looking at things on a wider scale, the Pro Literacy Initiative suggests that more than 60% of all state and federal corrections inmates are considered functionally illiterate, and that annually the healthcare costs in the U.S. are 6 times higher for individuals who are considered to have low literacy skills than for individuals with high level literacy skills. So, what can we do? We can take a look at some other counties that have looked into equitable plans. For example, in King County, Seattle, they have also recognized the need for communication and education tools and methods to connect both internal employees and with their diverse residents. They came up with 4 goals to address their communication needs. The first goal is regarding language access. Their plan is to update King County tools for public facing communication and education to align with the current population's needs and demographic changes. The second goal evolved around engagement access. They plan to develop tools for better engagement, regardless of neighborhood, immigration status, disability, or primary language. Further, they plan to improve engagement by increasing capacity building, outreach, and marketing buys with smaller community based organizations and media outlets. Their third goal is regarding technological access. They plan to improve the collaborative use of mobile optimized web pages and social media as an engagement, outreach, and feedback tool for the public. And their fourth and final goal for communication in education is to improve collaboration and language related tools and resources for employees in order to provide more services to those who speak languages other than English and in order to include more community member voices in the policy making process. So we definitely plan to kind of look into what they've done and see how we might be able to capitalize or utilize some of their same tactics. And then we have the city of Arlington. And in order to combat inequitable communication needs and disparities, they conducted separate focus groups to speak with vulnerable populations to better understand the needs of these specific populations and how they think their disparities can be diminished. A lot of the groups suggested communication inequities, whether it was regarding language resources or access to resources and information, and for the concern of the community not being aware of available resources like educational assistance, job trainings, work opportunities, and other community resources, the City of Arlington presented a short term recommendation of creating a community outreach network empowerment communication tool, or an acronym they created called CONNECT, which is a centralized location for resources and information assistance. So if you take a look here, this is an example of the kind of policy resolutions um, we're looking to make here. So this was made in the city of Arlington, and these are the kind of, like I said, policy changes we're hoping to see an impact here with the work we're doing within this communication committee. So if you take a look, we can see specifically what groups this policy resolution is hoping to affect, as well as their commitment to accommodate to these groups. And, just them being specific in their language, specific with their groups, and specific in their commitment, it doesn't leave a lot of room for, flexibility. It's clear, it's cut. We know exactly who we want to affect here, which is important, especially in this era of COVID-19 with all of the misinformation. And, we're just receiving so much information from so many, sources and avenues. And, lies and inaccurate information, they're as old as humanity itself. But never before have so much information been coming to us and spreading as easily as it does today. We have so much information coming at us from so many different directions that the World Health Organization has dubbed the divulge of information an infodemic. Okay. So, especially again in this era of COVID 19, we can even see the various ways that different populations are receiving and interpreting information. For example, populations of color have been disproportionately affected by COVID 19, yet the Black and Latino and Native American communities may be hesitant to get the vaccine. But of course, we can contribute some of this behavior to past harm done to communities of colors by medical research injustices in history. Cases like, the Tuskegee study experience, and so many others, okay? Regardless, this is still a form of health misinformation, which is basically information that is false, inaccurate, or misleading according to um, the best evidence at the time. So, health misinformation has been on such a rise throughout the pandemic that the Surgeon General Advisory recommends health professionals proactively engage with patients and their communities about misinformation as they come in for appointments or even just when they call in for questions. Which brings us back to health literacy and meeting the patients and the community where they are as we pursue solutions. So, with that being said, as we prepare to engage with our community and our organizations, I think it's important. Um, I think the information from this webinar might be interesting to consider. Though this webinar was discussing patient care in healthcare settings, I believe a lot of information can be applied to the ways we communicate to, for, and about our vulnerable populations. So, for example, the bias, stigma, and stereotypes that exist when we discuss certain populations and their needs, or better yet, the bias, stigma, and stereotypes that exist when we listen to these populations discuss their own needs. The ways we discredit the experience of certain communities due to their language or dialect may, uh, or maybe even their lack of understanding of certain systems and resources around them. So, due to the stigmas and stereotypes, as a society, we have created a system of distrust for certain marginalized groups. We've made ways to minimize their needs, mock, mock their languages as they come in. So now we have to figure out how we can create trust so that people feel confident and comfortable enough to communicate their needs. And so, according to this Words Matter webinar, some ways we can do that is by recognizing that not everyone has certain communication skills, education levels, socioeconomic statuses, or even just knowledge of certain services and resources that exist for them. Nor have they ever experienced dealing with some of these services and resources. So even myself, I'm educated, I'm literate. I might go into a setting and I've never had to experience these settings before, so I don't know exactly how to navigate them. So imagine someone who may have language barriers or may have, may not be as literate as I am or have the kind of education status that I have. Some other things that we can look into is, reciprocating the trust that is given, respecting that some of these members may not trust you given their experiences, and that's okay. You know, understanding, just the different layers of expertise that these communities have over their experiences. Basically, just trusting people when they let us know what their experiences are. Ask them ask the community their needs and their thoughts of certain policies, or what their disparities are and how they can be affected, and just kind of creating that two-way dialogue, um, receiving information and taking in the information from both sides, and again, just trusting their words and their experiences. So how can we diminish the sense of being hyper scrutinized but overseen for some of these people? It's like they walk in, they feel judged, but yet they also don't feel heard. It's a very interesting, place we found ourselves in here. Okay, I apologize about that. Okay. So then we'll go ahead and just move into the discussion portion of this here. Again, like I said, I did want to go over a little bit of data just to kind of get everyone's brains turning, but more than anything, I want to hear from you all, about what you're hoping to see here, um, what kind of changes you all are looking to affect. So I did have a couple of questions, and I definitely want to hear you all's feedback if you could. So the first thing is, what are you all hoping to accomplish within this committee? What kind of information are you all looking for here? Or maybe what kind of information are you looking to share here? Anybody?
I think for us, it's everybody that's on this committee, right? So we can coordinate information sharing, etc., really routinely, not just during the pandemic, but also getting this group together to decide there are pockets of the community that are difficult to reach from a communications perspective, but together we may have contacts or influencers or coming up with a strategy for each one of those segments of our population that you had outlined earlier. What's the most appropriate way and message to get information to those different segments of our community?
Absolutely. Thank you, man. And I think that's important. We definitely have to figure out who's missing what information and why. So I definitely agree there, Matt. anyone else like to chime in before we move on to the next question? Okay. So, what are some communication inequities you all have experienced or maybe even seen just as you move through your community or maybe even your organization specifically?
I just know, like, in a hospital setting, they use the communication. What do they call it? Like the telecommunication thing, where
Hmm.
you're able to, put in the whatever language you're wanting the person to speak to another person with the same language. And I just noticed that with medical staff, sometimes they feel as though that is frustrating or they don't want to do it or it's like a hassle to do it. And, body language is everything. So
Right.
when you're in that setting and you see somebody who's needing to get on the language line, I've seen people get pushed to the side or pushed back, have longer wait times, or, feel less than because they're not speaking a language that's as common. And so for me, I have seen that. And like I said, I don't know if it's an easier way for it to be done because they can do it over the the phone as well. Um, but that's just one of the areas because I have experience in a hospital setting where I would like to see, that kind of be addressed. I can only imagine what it's like in a school district. I'm not sure, but if it's like that in a hospital, I'm wondering about the kids who are students who don't speak English or Spanish. So I would like to see, I've witnessed those things and kind of experienced it. So I would just kind of want to see how it would help our community to addressing an easier way for both patient or child or student and the providers.
Absolutely, Tanya.
And I've also noticed, my name, I didn't get a chance to introduce myself. I'm Nikos Elzy, one of the team members here at Tarrant County, and I work with the transportation subcommittee. One of the things I did observe while riding the buses was that there was a lack of multilingual communication, uh, things like handouts or schedules on the bus, and even there were times where I would say multiple drivers really could not communicate in the other language, so it took passengers to help these passengers who had questions. So I think that's one of the things we can work on from the transportation aspect of it is making sure that all, riders or participants in public transportation can have that access to clear communication when it comes to riding the bus.
Thank you, Nikos.
Hi, it's Deanna. I just wanted to say that even though I do speak Spanish, sometimes I find it hard because I don't speak that type of Spanish. If it's somewhat, you got people from El Salvador, Honduras, even trying to keep up with Puerto Ricans is hard for me. Yes, I speak Spanish, but at the same time, you know, you're bringing in so many people with maybe just because we lump them all in the same category as Spanish. And each one of those cultures has their own, communication skills or whatever. And so for me, it's kind of hard when everybody's lumped into the same bunch with it's, I mean, for me, it's just hard because like being a Spanish speaker, it's like I feel like I'm doing them a disservice when they send them to me because I cannot communicate correctly, and especially when Tanya was mentioning the medical field. Whenever they have a non-native speaker translate, you lose so much in that translation that you're really doing a disservice to people.
No, absolutely, Deanna. I can definitely relate to that. I'm not fluent in Spanish, but I speak a little bit of Spanish myself. But I learned most of it in school. But then being in an actual work setting, where you have a various amount of Spanish speakers come in, you don't understand them, or they don't understand textbook Spanish either. So I can definitely relate. And it also makes me think about just the earlier slide, as we seen in the two zip codes that were mostly Spanish speakers, but it doesn't take into effect that some of those Spanish speakers don't speak the same Spanish. So definitely thank you for bringing that to our attention.
I think one important facet of communication, at least nowadays, is how much technology plays a role in the ability to communicate. There's so many pockets of Tarrant County where adults and children lack internet access. And if that's your only method of communication, or lacking cellular data, if those are your only methods of communication, you're kind of cut off from a lot of the major services that are provided nowadays. So I think focusing on accessible technology might be a critical component to this work in the future.
No, absolutely, Kylie. Absolutely.
That is something we're doing in the Fort Worth ISD. I don't know if you've seen some of our progress reports, but you'll recall a couple of years ago we passed the TRE. That was a sort of a bond funding thing. Most of the money was used to erect cell towers and also to give away thousands and thousands of personal devices to be used by students at home, but also to be used by their parents to get work done. So that was part of the deal with that. We continue to take surveys to identify families who do not have access to the internet, because it is so important. It is really what is it's a tool of empowerment, and we see that. Going back to some of the earlier discussion, my team is the communications, information, and marketing team. And we have a rule around here that we have to say something 7 times before it is received by our audience. And that's because I think you mentioned this, Tanisha, you talked about we're being overwhelmed with so much information. We get so much on a daily basis that sometimes we think, okay, one and done. We've got it out there. Now we made this connection. What we're finding is that it has to be a continual source of information, even repeating the same messages over and over again with a wide variety of conduits. It can't be just the internet, the website. It can't be just our telephone calls out. We have a live call out system for parents. It can't be just text messaging. It can't be, we're in our pre-K and general enrollment campaign right now. It can't just be our TV commercials. It can't just all of those things and more right now. And we are constantly looking at ways to update our effectiveness, especially on social media. We know that our parents are on Facebook. We know that our kids are on Instagram. And we know that opinion leaders are on Twitter. But you can't ignore any one segment of that area. So this is very interesting to me, and really confirms pretty much what we've been doing and what we continue to aspire to do.
Yes, thank you, Barbara. Thank you. And I believe I did come across some of the information that you mentioned earlier. I know I did come across it. I didn't find enough to make it a slide itself, but I definitely do look forward to looking a little bit further into that and seeing what all you all have to offer.
Thank you.
Yes, ma'am. Okay, just to keep things rolling then. I definitely appreciate everyone for sharing. I did have a couple of more questions that we can dive into. The next one will be, does your organization have some type of equity plan in place? Has it been successful? And what kinds of areas of opportunities for improvement do you all see for those equity plans, and how we might be able to implement some of that here into what we're doing with the, Tarrant County, the Unity Council? Yes, thank you, Barbara. Thank you. And I believe I did come across it. I didn't find enough to make it a slide itself, but I definitely do look forward to looking a little bit further into that and seeing what all you all have to offer. Yes, ma'am.
That is something we're doing in the Fort Worth ISD. I don't know if you've seen
It was a loaded question. I know. I know.
So I can answer once again on that. The Fourth Independent School District has an entire division devoted to equity. It's called the Division of Equity and Excellence. And this has been all mandated by the fact that we have an equity policy that was passed by our school board about 5 years ago. We do equity walks in our schools, and we look at everything through an equity prism. One of the first questions we ask before we make any changes or buy anything or just talk about a communications plan is, one, does it lead to improving student outcomes? And the second question, is it equitable? Not
Yes.
equal, but equitable. And that was one of the first things that I think we did. All of us in administration have been through equity training of about 2 years. And we first learned the difference between equal and equitable.
Right.
And then we went into more nuanced kinds of instruction. So that really is where we start. And we're led by a very wonderful Chief of Equity and Excellence, Mrs. Sherry Breeze. Some of y'all may know her, but she is always there. If we're not asking that question of ourselves, she's asking us to ask that question of ourselves, which is very helpful.
Yes. Thank you. I'm definitely gonna have to look into the division of equity and excellence, and see what kinds of things we can pull out of there. Again, I definitely look forward to partnering with you all. Anyone else?
In Everman, we don't have we're working on a plan. We don't have a division or anything, but we are working on a plan to make sure that we are being more equitable. We have a new superintendent this year, so that is one of her goals to make sure. So we are in the process of working on it. But of course, that means that it goes to someone else that other duties assigned, but that's okay.
No, absolutely. And again, that's what we're here for. Not only for Tarrant County to partner with you all, but for you all to partner with each other. So with you all coming up with an equity plan, and then Fort Worth ISD already having one in place, we definitely would love to see you all collaborate as well and see how you all might be able to build upon one another.
Thank you.
Absolutely. Uh, Anyone else? That's okay. That's okay. I think what Miss Barber has shared with us has definitely been very informative and definitely something that we definitely want to look into. So, just a couple of other questions. What kind of other policies for those of us who are, either forming a plan or may not have a plan? What kind of policies can be implemented in your organization, or maybe just for the community around you that you live and work in? What would you all like to see be implemented? And what might they look like?
Hey, Tanisha.
Hey,
I think there are some basic, right? Some basic things that could be done. Targeted communication and messaging to different communities by people that are reflective of their population. Um, I also think that perhaps something could be done to get clear, consistent messaging out sooner in terms of planning, not this would be in terms of planning for the next public health emergency as opposed to just our everyday communication efforts, but in terms of planning for the next emergency, I know that just here internally in Tarrant County, as an employee, I was privy to the situation reports that started coming out each day from leaders in public health that kind of just gave a little update on what was going on over in China and other parts of the world as things started kind of ramping up. And so eyes all over the world were keeping tabs on this information as it was happening, but it was also kept internal. And because I saw that information, I was able to go home and have a little sit down with my husband. And my husband happens to be somebody that he's not completely irrational or anything, but he can sometimes be a little bit susceptible to uh, I guess you could say conspiracy theories. You know, sometimes I think that we've seen that a lot throughout this pandemic, that there are folks that are kind of like, yeah, this is the message that we're hearing, but is that what's really going on? You know, I think that there's this human nature, especially here in the United States, with the way that our government system is set up and with the freedoms that we do have to question authority. That it's kind of a natural inclination to wonder whether or not we're getting the full story, or whether or not people in charge are keeping little bits of information from us. So, that being said, my husband can sometimes be a little bit susceptible to that way of thinking. And because I had access to that information early on, I was able to go home and talk to him about it and say, hey, just so you're aware, you may be seeing this on the news soon. And when you see it on the news, it may look like this. It may sound like this. And it may seem a little scary to you, but you need to know that what's coming is a public health response. And it's going to seem a little crazy, and it's going to seem a little perhaps heavy handed, but it's what needs to happen in order to keep people safe. And it helped him. It helped him because all of those things did happen. And it helped him that I was able to explain that that was coming. And I oftentimes wonder if things had been handled differently at a federal level, at a state level, at a local level, and information had been dispersed consistently and in a timely manner, so that rather than things coming to the big broad public as just all of a sudden and go from this to this, I think that that was really scary to people, and I think that it increased distrust. And I think that things could be planned better next time. I think that it's not just the way we disperse the information. It's not just what the information looks like as it goes out to communities. It's also that timeliness of, if we know something's coming, instead of holding it in, let's go ahead and start preparing people. Let's go ahead and start getting it out there. Hey everyone, be aware of this. This is happening. Um, you know, in public health, in hospitals, in large places, most of us have public information officers. We have people that are designated to be the spokesperson for our organizations. But I think that some smaller places and community-led efforts within neighborhoods and things like that, they don't necessarily have that. So I think that going forward, to like plan to have those contacts with those people, get that information out consistently, get that information out early so that people know what to expect, so that it's not a surprise, so that they're not hearing one thing over here and another thing over here. I think that that's really crucial and fundamental to what we're trying to do. And then when you look at that planning, how do we make sure that that information is hitting these disproportionately impacted communities the same way that it's hitting the people that traditionally get the information? Everybody should have equitable access to that information in the manner that's most comfortable and most well received to them. Sorry, that was a little long-winded.
No, but that is exactly what we need, though. I mean, that's exactly what this is all about. You know, we know that some people receive information and some people don't. We want to figure out who and why, especially when it comes to information like receiving the vaccine or what to do in a crisis. So you're absolutely right, Lauren. Anybody else have any thoughts? That's okay.
I can quickly just jump in and give you guys a little bit more background on how iHeartMedia can assist in
Yeah.
some of these challenges. Because of the nature of our business, we have several, over 850 radio stations across the country, but several radio stations locally all reach different audiences through broadcast radio. We're able to also do the same very strategic targeting through streaming radio. So that would be radio that you hear on an app or even a smart speaker when you just tell your smart speaker to play music or podcasts or something like that. We can target one-to-one to specific audiences, so people who show online activity of using certain languages on their browser, or certain listening to certain shows that come in certain languages. And so we can target specifically, and we can actually use that target based on the percentages that you gave. Like, for instance, 12% with limited English proficiency in Tarrant County, we can take 12% of the audience that we're targeting and go for people in other languages once we know what the breakdown of that is. So we can match our breakdown of how we target to exactly what the breakdown is of the population and um, what their language proficiency is and what languages that they are speaking. And so we can do that through tons of different types of entertainment, whether that's radio, people listening to music, people listening to news and information. We can drill down in several different ways with different audiences. So, for instance, I mentioned earlier the Black Information Network. That's a 24-hour news and information network that was built by and for the Black community, with Black leadership and Black journalists across the country. And we have a station here in the DFW area that we can use to make sure that the Black community is informed through a lens in a way that is highly trustworthy um, news and information. And then we could do the same in different ways with the Hispanic communities. We have a podcast network that was put together by Lynn Manuel Miranda and Eva Longoria called the Mi Cultura podcast network. And we can cut out the audience that only affects Tarrant County, right? We can, even though these podcasts are nationwide type, things, these stories and the content is affecting the Hispanic community, and we can take out the excess and only target people who are in Tarrant County using some of these different types of tactics.
That is amazing, Roy. That is amazing. We definitely want to see what kind of data we can get you all so that y'all can look into those things and target those specific communities for us. We definitely want to utilize your services for sure. And thank you for sharing.
No problem. Thank you.
Absolutely. Okay. We're gonna persist forward. So just some last closing remarks. This meeting is the third Monday of the month. In a follow up email, I'll definitely send out a poll so that we can see when we would like to have this meeting reoccur throughout the month. I'll definitely have the third Monday be a top option for us, given that we had a pretty good turnout today. But there'll also be some other options, that way we can see what works best for everyone's schedule. Another thing that will be in the follow-up email is that I know previously in our Unity Council meeting, some of you that are a part of this committee did also express interest in our community, our education committee as well. And since I'll be heading both of those committees, we do want to kind of gauge and see how people feel about potentially combining the two of those. But then again, like I said, there'll be something that we'll follow up with in our follow up email after this. Okay. Does anyone have any closing questions or remarks as we look to close things out?
I just want to just say that first of all, this was good. um, moving forward, there has been a lot of equitable like plans put in place. A lot of people are focusing on equity, and I don't want it to be a situation to where we are putting something in place and not actually going forth with it. I want us to be able to get the community involved, really reach the people, really service the people, really help people who are in need of it. Talking about it only goes so far. So, being a part of this committee and, collaborating with everybody that's here, I want us to be able to come with a plan that really, really reaches people and not just have it, these great ideas that goes nowhere. So, that would just be my take on it. I'm looking forward to working with everybody and hearing what people have to say and trying to see what ideas everybody have and what they think may be what we should do moving forward. So that's my only thing on that.
Absolutely. Thank you, Tanya, for sharing. And just to kind of piggyback with what Tanya is saying, as we continue to have these communication committee meetings as well as just the Unity Council meetings, please feel free to extend the invitations to your colleagues or anyone you know that might be interested in, joining our efforts here with the Unity Council or specifically within communication here. Okay, so please feel free to share anything, and if you have any questions, please don't ever hesitate to reach out to me or provide my contact information to anyone. We definitely want to get as many people involved here as we can. That way, we have a diverse group of people here with diverse experiences and, diverse solutions. Okay. I definitely look forward to seeing some of you later in the training. If you haven't, definitely go ahead and join us there. We'll definitely send out a link, a reminder, and I look forward to seeing you all in our next meeting. Have a good one.